to order at 11:03. Roll call, please.
Powell is not here yet. Gingell,
Here.
Gershenson. Looks like she's here remotely. Jackson is absent with notice. Nelson,
Here.
Cavell,
Here.
Joliet,
Here.
Lubes,
Here.
and McGilvery's not here.
Thank you. So our next item is the Pledge of Allegiance. Please join me in rising for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And I would like to know that one of our commissioners, Commissioner McGilvery, passed away this week with visitation Thursday and Friday. So he's been active for decades in first the city government in Madison Heights and numerous committees in Madison Heights. And then as a commissioner from maybe 2008 to this year. Many years of wisdom and experience and mentoring he provided to each of us. So I would like to recognize and honor his commitment to Oakland County. All right, we move on to our business. The first item is approving the minutes from October 10th. I have a motion by Commissioner Nelson, support from Commissioner Joliet. All in favor say aye.
Aye.
Opposed? The minutes are carried. We move on to approving our agenda. I have a motion by Commissioner Nelson and support from Commissioner Gingell. All those in favor say aye.
Aye.
Opposed? All right, our agenda is approved. We've arrived at our first public comment for items on the agenda. Is there anyone from the public wishing to comment? All right, public comment is closed. Our first couple of items are communications and presentation. We were gonna do the presentation first, but now we have a quorum, so we'll go back to communications. There are 7 items under communication. The first is the grant application to the Council of State and Territorial Epidemiologists for the State Data Science Team Training Program. The second is another grant application to the National Association of County and City Health Officials for evaluating the distribution of smoking supplies as a harm reduction strategy. The third is another grant amendment to the fiscal year 2024 Emerging Threats Local Health Department Agreement. The fourth is a medical marijuana operation and oversight grant performance report, July through September of this year. We have the September report from our animal shelter. We have a report from the Haven, July through September 2023. And the last item is the director's report from Oakland Community Health Network for September 2023. Would anybody like to make a motion to approve these items? We have a motion by Commissioner Nelson, support from Commissioner Joliet. Any comments on these items? All right. Commissioner Nelson.
Thank you, Madam Chair. I just wanted to bring some attention to item D, which was the medical marijuana operation oversight grant performance report. One of the things I just really want to say is I really appreciate the safety lock boxes that we just distributed here just a couple months ago. I don't know about my fellow colleagues, but I do know that within my communities, it was something that was really, really sought after. So I just want to give the health department a shout out because it really was a success.
Thank you. They're quite nice boxes. Want to prompt the vote?
Yes, please. Joe?
Yes.
5 yeas, 0 nays.
All right, communications are approved. Thank you. We move on to our presentation. We have Oakland Community Health Network's presentation on justice initiatives, so I would invite you to the front of the table and be happy to hear from you.
Good morning.
Morning.
You wanna go? In front, yeah, in the middle. That's fine. Yeah.
And protection.
We have about 17 slides, but I'm gonna go through them rather quickly so I make sure that we stay on time because Barbara told me about the 27 agenda items. So if you know me at all, I talk very quickly anyway, so. Good morning. My name is Tricia Zizumbo. I'm the Director of Justice and Training over at Oakland Community Health Network, and I am joined by Siri.
Good morning, my name is Siri Socorro. I'm the manager of Justice Initiatives.
We'll briefly, maybe. Okay, there we go. Oakland Community Health Network is your local community mental health authority. We oversee the local public mental health system that manages serious mental illness, serious emotional disturbances among youth, intellectual and developmental disabilities, infant mental health, and substance use disorders. I'm gonna just swing through this pretty quickly to get to. We approximately serve about 27,000 people. Suzanne might correct me on that. It changes every year a little bit. 29,000 already changed. So that's about how many people we serve each year. For our Justice Department, we use the sequential intercept model. If you're not familiar with the sequential intercept model, it is from SAMHSA, and it really shows all the different areas where we can intersect with someone who maybe has a mental health or a substance use disorder along the continuum of the justice system. So we're looking at everything from prevention, intervention, all the way to postvention. So this is what we base our programs and our services on that you will see here in a little bit. I didn't choose the right seat where I gotta keep turning around here. So our goal for every point within our model is to decriminalize mental illness and substance use disorders. We really want to divert people from the justice system where appropriate into further treatment and then engage them in our local resources and supports. There we go. Barbara's up. Maybe it's just delayed a little bit. All right, so our Intercept Zero. So this is where we start with our prevention. Some of you are probably familiar with our Resource and Crisis Center right here on the county. This is, again, not in the Justice Department, but we really want to highlight some of our other departments where we intersect with them a lot. This is where our crisis providers are housed. So our adult crisis provider is Common Ground. Our youth crisis provider is New Oakland. I believe some commissioners might be able to go and tour that coming up later this month, our Youth and Family Care Connection. Also housed within there is our Access Department, which is really the front door to accessing our system. We have our RISE Center that provides supports and resources, and our Sober Support Unit. We have hospital liaisons within our clinical team where we partner with all of our local hospital and emergency departments, and then our outpatient supports through our clinical team and through our provider network of approximately 300 providers. All right. So when we're at our Intercept 0 and 1, when we're looking at really that very beginning of where someone can intersect with the justice system, we're looking at our co-responder program. So currently we have 4 co-responders in the community. You'll see the communities that they're in right here. We are hoping to add 3 coming up soon with some communities that we are talking about. But this is really, our co-responders respond with law enforcement. So some of our co-responders are in the vehicle with the law enforcement. So our Pontiac co-responder, Sammy, is in a mental health vehicle with the sheriffs, and they respond to all the mental health calls within Pontiac. We have a co-responder in Troy, Ken, who has a city vehicle, and he responds to dispatched calls or self-dispatched within the city of Detroit within the city of Troy. We don't go that far to Detroit. They might want us to, but we don't. And then our 2 co-responders oversee 4 communities for Auburn Hills, Birmingham, Bloomfield, and Rochester Hills. And they split those communities up and respond to calls within there. Communities that we're currently talking with and in the beginning stages of contracts with, so it's nothing approved yet, but Waterford, as well as Madison Heights, Hazel Park, Ferndale, and Royal Oak to add an additional co-responder. And of course, I'd be remiss if I didn't bring up, we do have an ARPA funding proposal in, I believe, to this committee for additional co-responders throughout our community. So the whole county, we would like eventually to see upwards of about 15 total co-responders. I did pull some numbers this morning for you. Since we've started in 2021, which was about 2 years in August of this year, we've had almost 3,000 referrals. So our referrals are from law enforcement when our co-responders are not on scene or not working on their days off. They work 410s right now. In just this fiscal year, they've served a minimum of about 1,600 people. But we know that that doesn't capture anybody. Those 1,600 are just from our police report. Want to add in
Right. Oftentimes, family members and neighbors are also on the scene, so law enforcement will trigger a referral for the person that police was called for. But if someone else that was on the scene needs assistance, we capture those as additional people served. So the number that Tricia was mentioning is only the ones that we're getting referred over from police directly.
So we know that that number is more than just that and that we're really reaching out into our community more. And next up is our pre-booking jail diversion. This is in addition to our correspondence where we look to divert nonviolent misdemeanors from the jail into treatment where necessary. So we see about 50 diversions a month, but this also doesn't include our law enforcement partners who divert on their own, who maybe are working with someone and instead of arresting them are taking them to Common Ground or taking them to the sober support unit. Or are connecting them with resources as well. Next up is our CIT program. So we oversee the CIT Oakland initiative, and CIT is Crisis Intervention Team. And so this is a program, again, with training and having programs at the law enforcement agency around mental health and diversion. So we have been conducting training since 2015, which predates my time at OCHN, but it really focuses on those positive outcomes and again, getting the people that we all serve within this community into the help and treatment that they need. So we have trained since 2015, 1,133 law enforcement officers throughout Oakland County. And that has significantly increased this past year thanks to ARPA funding, again, from the board, where we've trained 121 officers this year alone, which is significantly more than our previous 5 years. So that we are having more and more trained law enforcement on the streets to be able to appropriately respond and divert people into treatment and really connect with our system and other partners to help the people that we serve. And I'm gonna turn it over to Siri.
Thank you. So for the next couple of slides, I will continue to talk a little bit about the positions that we have embedded with some of our justice partners. So our behavioral health and justice liaison is embedded in the Oakland County Prosecutor's Office. It is still one of our newer efforts. We're currently in our 2nd year. But the intention behind that job, it is a clinical position. So the prosecutor's office can refer any adult or youth over for some clinical assessments. We look at substance use and mental health concerns, and then connecting those individuals to mental health, community-based mental health services. If there appears to be a concern around a crisis, we do refer them over to the Resource and Crisis Center. We do have the Oakland County Jail split up in 2 different slides, so I will talk about a portion about it right now. We have a variety of different mental health services in the jail that we fund. Specifically, we have one clinical liaison that works with individuals closer to discharge to ensure that they're connected to mental health services once they return back into the community. And this is regardless of insurance status. Most of the people we do see have Medicaid, and we can connect them to our provider network, but if someone has private insurance or no insurance, we still connect with those services. services. That liaison also makes sure that if someone is in need of housing, we can refer over to the shelter, provide bus tickets because people don't always have transportation available. Sometimes people book into the jail in the summer and leave in the wintertime and don't have clothing, so we will make sure that they have clothing as they leave the jail. Also, OCHN funds the jail-based services, mental health services in the jail. So those are currently contracted through Easter Seals, where we have a psychiatrist that can provide the evaluations and medications. We also provide funding to the Oakland County Jail to implement one full-time position and 2 part-time positions of jail caseworkers that oversee the post-booking jail diversion program called JAWS. The clinical services are again utilized through Easter Seals that we fund as well. The treatment courts is probably one of our oldest connections that we've had with the justice system. We have a very long-standing relationship with the adult treatment court at the circuit court, and since then have really moved into some of the district courts and then have expanded again within the circuit court when the juvenile mental health court was created, and then as of recently, the juvenile drug court. So we have a total of 4 liaisons that are OCHN employees that provide that clinical expertise for people that move through the treatment court program. They also close that gap of communications that at times can exist between court, person served, and then the provider network. One of the courts that we're currently putting a huge focus on is the probate court, specifically around assisted outpatient treatment. So at this moment, we fund a position through one of our crisis providers that is that front door person, contact for the community if they have questions on how to file a petition around assisted outpatient treatment. They provide a lot of system navigation, just that hand holding a little bit as that person is filing for a petition. OCHN also recently brought on a coordinator that again closes that gap of communication between provider network and probate court as someone has been placed on a petition for court-ordered treatment. It's definitely an initiative we're continuing to look at to really make sure that people that are placed on these court orders are receiving the appropriate services. So we will continue to work around that initiative. Coming back to the jail services, this is specifically around reentry services. We have a coordinator that specifically provides discharge planning for anybody that was receiving psychiatric services in the jail. So we get the referrals as soon as the person books into the jail. We watch to see when they're getting close to discharge, and then we engage on a one-on-one basis with them, even though we also provide group discharge planning, and really finding out what does this person need as they're transitioning back into the community to be successful. And that can be a variety of things. Again, mental health services is something that we connect for, but does the person have housing? Do they have transportation? What are their needs? And we work on a one-on-one basis with them. We also make sure that anybody has a prescription sent directly to the pharmacy as they're being released from the jail. Our last position that focuses on adult services is our mental health probation community liaison. As you can see, that person works directly with the with parole agents, probation. We receive referrals from MDOC for people that are required to obtain substance use services. So we do a lot of system coordination, making sure that people are not falling through the cracks. Right, a brief snapshot of around our juvenile justice services. We currently have 4.5 positions that work with youth and families directly. The first initiative is around early identification. We have had a grant with MDHHS for about 7 years where we can service kids as young as 5-year-old to up to 17 to provide brief screening tools around concerning behaviors, and then again connecting them to mental health services, substance use services. Do they need a mentor? Just providing some recommendations to the families. Obviously at 5 years old, kids are too young to be involved with the justice system, but they might display some of those behavior concerns that could lead to future justice involvement, and that's really what we're trying to prevent here. We also have, we also have some coordinators that work with justice-specific partners. So we receive referrals from youth assistants, all from family division at the circuit court level, from diversion to probation to reentry, as well as Children's Village, connecting kids to mental health services, regardless of where they're at and regardless of age. All right, now it's back to Tricia.
A few things to add in that weren't in the PowerPoint that our justice team also oversees is we have a CISM team, which is a critical incident stress management. That is a post-vention providing kind of group debriefing after critical incidences. This is built off a foundation used within first responders, but we have been kind of soft launching it this year for our community and being able to respond to different incidences with a volunteer team of, after this week's training, almost 30 OCHN staff. And then also our behavioral threat assessment and management initiative. So we work closely with the prosecutor's office on their gun violence commission. But for the past year, we have been meeting regularly with the sheriffs and with our FBI partners, and even connecting with some of our school partners and our courts regarding behavioral health threat assessments, looking at those evidence-based tools, helping train schools with Oakland schools on that, but also reviewing cases brought to us by FBI and partners to look at mitigating threats of mass violence. So this is our QR code for just OCHN overall. Suzanne would be mad if I didn't include it in every PowerPoint, so that is included there. Our chief is Dr. Posios, who was unable to be here today. But any of our contact information, I have cards too. We know we went through that fast. It's a large department of about 17 staff, not including our supervisors, managers, and director. But extremely proud of this team and what we do within the community and our justice partners. So,
Good, thank you.
okay, thank you.
Thank you. So the difference between the crisis intervention team and the co-responders is that the crisis intervention team provides education to our local groups or police
Yeah,
departments?
so CIT right now is focused right on law enforcement, training law enforcement, but then also providing some of that technical assistance. True CIT program is CIT trained officers who respond to mental health calls. They have an additional 40 hours of training to be able to appropriately respond. We are branching out into dispatch. We have done corrections in the past. We will be reviving that from 2015. We have been talking with the Medical Control Authority and how we can train EMS. And then also I have a few fire captains that would like to get involved as well, so that anyone who is responding to someone who is in crisis is trained appropriately on really what is mental health, but also all the resources. We're actually pretty fortunate in this community to have the amount of resources, even though I know we still think it's not enough, because I know I think the same as well when you're dealing with this many people in the community. Whereas co-responders are master's level clinicians who are embedded within a law enforcement agency, and then they're responding on scene. Most of the time with the CIT trained officers, we try to set it up that those partners have at least 20-30% of their force trained in CIT, but then they can provide, again, that clinical aspect of that.
One of the communities I'm familiar with is Troy, and they absolutely love Ken, the co-responder there, so he's doing a great job.
Good, it's always good to hear. We actually have some grants out to hopefully bring in a second co-responder to Pontiac. Been working closely with the sheriffs around that as well. So it's definitely expanding quickly. It will expand much quicker with funding, but we're excited, and our city managers and our police chiefs have been amazing to work with. We just met with Waterford last week, and they wanted to go like next month, and I was like, I'm not ready yet. But it's really great to see our law enforcement and the partnership we have with them really embrace all of the CIT co-response and diversion.
Thank you. Are there other questions? Commissioner Ginzel?
Yeah, so thanks for coming out. I think this is a great thing. One thing that's on my mind is perhaps you could look at modeling just the business aspect of it. So let's say with the co-responders, you prevent X amount of people from being booked and going into jail, and what are expenses for that? And then on the back end, when they come out, connecting them to the right places, preventing them from recidivism and coming back in. If we know of the 27,000, again, just model it, like take half. If you affected half of the people from either being booked or coming back in, and we figured out a cost that you could apply, I mean, that would be helpful for me too, because not only is it having a benefit to the individuals in the community, but potentially to the jail, preventing overcrowding, overtime, all that other kind of stuff.
That was a great idea. I love that. We do work closely with Wayne State and their Center for Behavioral Health and Justice on a variety of data collection. That might be something good to talk to them about. And in my meetings and emails with Captain Vita, I think he would like that too.
Yeah, and you'll probably just have to come up with some assumptions and models, because there's not really anything to probably go off of. But at least it starts giving some magnitude to the back end impact of what you're doing.
That's awesome. Great, thank you.
Thank you. Commissioner Cavell?
Thank you. Yeah, this co-responder thing sounds very awesome. I had a couple questions from your PowerPoint talking about with youth. Siri, you were talking about youth. Are you guys part of, or I guess how much of your thinking relates to the child care fund? And you mentioned something about community-based interventions. That with the new, we heard before in this committee about a new funding formula from the state that incentivizes community-based things. Do you have anything there?
At this moment, I wouldn't have any information about that. We would have to go back and probably could follow up.
The entirety of our department, it relies on grants and general fund. So we would love if some of the things that we do within justice are Medicaid billable.
Yeah.
And we're always exploring those options. But it is relying on general fund to do these initiatives.
General fund from OCHN?
From the state and from the county.
Okay. And so then just to say, our portion has not gone up that we give to you since 91.
I believe it's the 90s. I don't know the exact year, but
Okay.
yes.
Just to let everyone know, I was born in 1990.
That was a long time
I'm
ago.
gonna go with
Right?
you too, Charlie.
Because if we remember right, the OCHN came and did a thing where they said our 9.6 million, if overtime was equivalent, would be 22 million a year, if it kept pace of what it was in 91 or whenever the spinoff happened. Opioid settlement, what do you guys, is that related to justice initiatives at all?
It is. We obviously don't receive any opioid settlement funds. We have been in talks with the county and exploring if our communities could use their opioid settlement funds to fund co-response.
Interesting.
So actually we have Barb coming to present to our regular core meeting. We went to the opioid listening sessions of that. I know I put in my 2 cents at those listening committees about funding some justice initiatives if that's possible. So we're looking into learning more about that and if those work, to be able to use those for co-response, at least for our CVTs. OCHN doesn't receive those funds.
Okay, thank you.
Thank you. Commissioner Joliet?
Quick question, just based on the funding. I'm trying to remember when OCHN was here, that our funding is based on a percentage of state funding? You don't, okay.
I'm gonna look over at Suzanne. That is,
Dana Dessel, I think, had given that.
Yeah, Lazenby, yeah.
Okay, I'm sorry,
sorry.
Lazenby.
That would be a good question for Patrick, who's
Okay.
our controller of that, but I could probably get that answer, one of us could, and get that back to this.
Okay, all
I'm not sure how general fund is.
Okay. right, thank you.
Yeah.
Any other questions or comments? Thank you, and I appreciate the collaboration with our courts. So it's a win-win situation for the people we serve.
And when we continue to work outside of that as well, we meet with our judges, we meet with the prosecutor's office, and really feels strongly that all of our partners really have the same goal in getting people into services that they need, so. I'll leave a couple of my cards here in case you have any questions.
All right, thank you,
Thank
nice
you.
to see you. Siri.
It was good seeing you too.
So I need a motion and support to receive and file this report. I have a motion by Commissioner Joliet, support from Commissioner Nelson. Do you want to prompt the vote? Sure. Okay.
There you go.
Gingell?
Yes.
60 yeas, 0 nays.
All right. The report is received and filed, thank you. We move on to circuit court recommendations. There are 5 items. 4 are acceptances. The first is the Administrative Office of the Fiscal Year 2024 Adult Treatment Court Program. The second is regarding the Juvenile Mental Health Program. The third is regarding the Juvenile Drug Court Program. The fourth acceptance is regarding the 2024 Combat Veterans Court Program. And the fifth item is the acceptance of the Byrne Grant for Adult Treatment Court Program. Would someone like to make a motion? I have a motion by Commissioner Nelson, support from Commissioner Gingell. And we have Chris here to talk about this. And you will have to introduce yourself again, thank you.
I'm Chris Pujek, I'm the manager of the Court Business Division for Circuit and Probate, and with me is...
Good morning, my name is Nate Gilling, I'm the Treatment Court Coordinator. I oversee the Adult Treatment Court Program, the Juvenile Drug Court, and Juvenile Mental Health Court.
Thank you.
Yes.
Okay, what would you like to say about these items?
Well, Nate, go ahead.
Certainly, so today we're asking for the committee's acceptance of the grants. These are through the State Court Administrative Office, Michigan Drug Court Program Grant, and the Michigan Mental Health Court Program Grants. The Adult Treatment Court and Juvenile Drug Court have been operational for 22 years. These are annual grants that we receive that cover our operational and professional services costs associated with our problem-solving courts. The Juvenile Mental Health Court was new last year, so we're in our second year. We had a very successful first year, so I'll share some numbers with you here in a second. As far as our Adult Drug Court, Adult Treatment Court, we have 94 current participants. We served 203 participants in total fiscal year 2023. So in comparison, that's up from 118 participants in fiscal year 2020. So you can see that the amount of participants served has nearly doubled in the last 3 years. Our Juvenile Drug Court currently has 13 participants served in fiscal year 2023, 7 current participants as of today's date. And then our Juvenile Mental Health Court took off faster than what we thought it would. So we currently have 11 participants that we're serving with the max capacity of 12. So we're right there where we want to be. In fact, we're in talks of adding a second caseworker in order to double that capacity that can be served just because there's such a high need for those individuals. Problem-solving courts in general, we serve moderate to high-risk need individuals. The goal of the program is to provide intensive community-based supervision with an emphasis on mental health and substance abuse treatment in lieu of any type of incarceration, imprisonment, or for our juveniles out-of-home placement. So we're very thankful for the committee's support, for the support of the Board of Commissioners, and we would ask that you accept those grants today.
Thank you. Anybody have any questions on the 5 items? All right, would you prompt the vote?
Gingell?
Yes.
Pass.
Cabell?
Yes.
Thank you. You have 6 yeas, 0 nays.
All right, motion carries. Thank you
Thank
for
you
your
so
work.
much.
Yeah, we
Thank
appreciate
you.
And again, we'd like to extend an invitation to any of the commissioners or staff here that are interested in learning more about our treatment courts or the court in general to come, and we'd be happy to show you around so you can learn more about what the court does.
I did it. It was fun.
There we go.
We have in the past taken tours of the court, but it might be time again to schedule.
Absolutely.
group
The
tour.
court-like technology keeps changing and moving, so we would love to host anyone that would like to come, and of course, we'd like to come and do kind of a state of the court presentation for you
Oh,
in the near
perfect.
future. Thank you very
Let's
much.
schedule that. Thank you. Thank you. Our next 5 items are district court recommendations. The first 4 items are acceptances of grants for the mental health court program, the drug court program, the state court administrative drug court program, The last acceptance is the State Court Administrative Office for the fiscal year 2024 drug program. And the last item is from the 52nd District Court Employment Policy Review and Acceptance. Who would like to have a motion by Commissioner Powell, support from Commissioner Joliet? And I have Alexandra Black here to talk about these items.
Hi, good morning, or good afternoon, sorry, or I'm not sure. Good morning. Thanks for having me here. So I'm here on the first two items, the acceptance from the State Court Administrator's Office for a mental health court grant. I think we talked about this a little bit when we were doing the interlocal. We had asked for more money this time, being that we're going into our second year. We did receive, or actually we're going into our third year, this will be a third grant. We did receive $67,000. We did ask for $130,000, and Scale has told us that they're being very careful about the amount that they're giving out, making sure that people are using every penny, which we did. We used every penny the last 2 years. So this $67,000 is gonna be utilized to continue to fund the liaison, the mental health court liaison that we have through OCHN, and it's worked out great. We did have our first graduation that went amazingly well, and we held it in the courtroom, and we're really proud of the graduates that we have. We have a couple more graduations coming up that I'll send out to you guys, so maybe if it's close to, you know, at one of the 52nds it's close to, it'd be great if you could stop in and see the fruit of your labor. So anyway, we're here to request that we can accept this $67,000 to continue on.
Thank you. Next item.
Oh, okay. So the next item is for our so that was our 52nd mental health court. This is for 52-1 Just Novi District Court drug court grant. We were granted $110,000. We asked for $149,000. This is an increase over last year. The $110,000 will be used to continue to fund our probation officer that handles our drug court cases. It's not quite enough to cover her salary and her benefits, but last year we were able to obtain more funds after the second quarter. SCAO did fund that, so that's our intention, is to go ahead and ask for that when the time comes. So we'd like to accept this $110,000.
Thank you. Commissioner Powell?
Because you have this off, like the second one, you gave us a resolution of how you figure that and the pay of fixing that. But with the 67, what is your option of covering that difference? Cause you said 133.
Yeah.
They only gave you 67. So how are you gonna plan to work that out with
We'll
that
do the
number?
same thing. I'm sorry, I should have mentioned that. We did last year, same thing. They gave us more money for the mental health court grant after the second quarter, and same for the drug court. We basically, again, because they are trying to force courts to use the money or not request the money if you don't need it. And there are other courts out there that are giving money back. And unfortunately, I wish, you know, if I was the boss of the world, I would look at it and say, okay, they're covering a position. That money, that amount doesn't change. I can't change that. But there are other times we use the grant money for things like a graduation or for incentives or training or whatever, and you don't always use all that money. That's not what we were asking for. We were asking to cover these positions. So if it were up to me, SCAO would look at us and say, okay, they're covering a whole position, but they don't do that. The flip side is there are other courts that are gonna give that money back. We will ask for it, and we did get it the last 3 years we were able to get it. So that's our plan.
All right, thank you.
Thank you.
Any other questions
Oh, that's it,
regarding these?
sorry. No.
Say it again?
I was just saying I'm wrapped up, thank you.
Okay. The third item, are you speaking about the third item, or is that somebody else?
I think isn't the third item
there-
52-2?
Patricia Bates here?
Oh, 52-4?
Yeah, she's
She's probably on Zoom.
Where?
Hello.
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 Oh, I see. I'm sorry. I was looking for cameras. All right. So, Patricia, is there anything you want to add on the 52-4 District Court in Troy, the acceptance of the State Court Administrative Office for the fiscal year 2024 drug court program?
Yes, we too asked for additional funds. Last year we were granted 120,000. This year we were granted 130,000. We were able to spend all of our money last year. And that is the plan again for this year, and probably asking for more as well during the midway point in April. But this will cover a position, drug testing, counseling, incentives, and training. And I just wanted to mention too that, we've been in operation since May of 2001, and Judge Dennis Drury was the drive behind that, and he passed away this summer. And I guess I just wanted to recognize his work is still going on.
Thank you. Yes, I represent Troy, and he was innovative in his day. So his name is still well recognized in Troy. Any questions regarding this item? All right, let's move on to the 52nd to District Court in Clarkston, the acceptance from the State Court Administrative Office for the drug program. And it's either Carol Bond or Brett Day who's here to talk about it.
Good morning, can you hear me?
Yes.
I'm Brett Derry, I'm the Court Administrator at 52-2 District Court in Clarkston, and with me is the Probation Supervisor and Treatment Court Coordinator, Carol Bond. We're here today to ask the board to accept the $12,000 grant that we were awarded by the State Court Administrative Office. Our program in Clarkston has been in existence since 2004 and targets high-risk impaired offenders with the goal to reduce recidivism. It covers all the same things Patty was just talking about, for transportation expenses, participant incentives, training for team members. At this time, we're happy to answer any questions you may have about the program or the funds and how we use them.
Thank you. Any questions regarding Clarkston's money? All right, then our last item under the district court is the 52nd District Court Employment Policies Review and Acceptance. And we have Jennifer Phillips here to talk about this item.
Hello, I think Judge Fabrizio is on the agenda too, but I think he has a doctorate this morning. I just wanted to say that we worked with Court Counsel, all the administrators, we worked with Court Counsel and HR. The court has been informally following the merit rules in almost every instance, but we're actually not covered by the merit rules if you look at Merit Rule 1.1. So what we did with this is just put together the policies in an organized format just to make it clear that which merit rules we're following. We also have to follow a lot of state policies. So this is really just an effort to clarify what we're following and what we have been following for years.
Thank you. Any questions or comments on this item? Commissioner Cabell?
I don't know if I understand what this is. Can you help me understand? Explain it more?
Sure. So the district court employees, if you look at Merit Rule 1.1, were excluded from the merit rules. So we're not, the court is separate, is responsible to the State Court Administrative Office, but also to the county, because that's where our funding comes from. And we follow, to the greatest extent possible, any merit rules that we can, and that's the goal. That's what we've been informally doing for years. But at some points, it's confusing. What are we following? The county has a nepotism policy, but so does the state. So we follow both. But this just is outlining exactly what we're doing, so it's clear for HR, it's clear for everyone, and it's clear for our employees as well.
So it's cleaning up the policy.
Yeah.
That's a good way to put it. It's cleaning it up. Again, we work with Court Counsel, we work with HR. It's just clarifying what we're doing.
Thank you. Any other questions or comments? All right, would you comment on the 5 items from the district court recommendations?
Angel?
Yes.
6 yeas, 0 no's.
Motion carries. Thank you, everybody.
Thank you guys so much.
Thank you.
Our next three items are from the prosecutor's office recommendations, and once again, they're all acceptances of grants. The first from the Department of Health and Human Services for the fiscal year 2024 Crime Victims' Rights Grant. The second, the 2024 Anti-Terrorism Emergency Assistance Grant. And the last item from the Michigan Department of Health and Human Services for the 2024-28 Title IV-D Cooperative Reimbursement Program. Who would like to make, I have a motion by Commissioner Powell, support from Commissioner Nelson. And we have Mary Larkin here to address this item. Hello.
Good morning, everybody. Just very briefly addressing first the anti-terrorism grant. We are here today asking the board to accept this grant renewal. It would be our third year. This grant supports the prosecution of the Oxford High School shooters case. And it allows for two positions. One is for a victim advocate and one is an office support clerk. We, as you may know, we work closely with Common Ground and their establishment of the All for Oxford Resiliency Center that provides mental health services and support services for anybody who has been affected by the Oxford High School shooting. So this program it allows us to notify victims of what's happening in their court case. You may be aware there's about 1,800 terrorism victims of the Oxford High School shooter, anybody who was an enrolled student, staff member, or faculty. So we're obligated by the Crime Victim Rights Act to notify them timely of anything that happens in their case. And we developed, with the help of Information Technology Department, a tremendous email blast program where we're able to send out a blast as soon as the trial team is back from court and something has occurred in the case. We are able to notify victims through an email simultaneously. It's been really effective. We get a lot of positive feedback about that.
Thank you.
So I'm happy to answer any questions about that. And just to give you what's on the horizon, on December 8th, the Oxford High School shooter is being sentenced by Circuit Court Judge Kwame Rowe. And so our victim advocates are actively facilitating the process of victim impact statements. Anybody who is a victim in the state of Michigan is permitted by law, by the Crime Victim Rights Act, to make a statement and let the court know how the crime affected them. They can do so in person, orally, in the courtroom, or they can write a letter. And we have about 44 victims who are intending to make an oral impact statement in the courtroom, and about that same number that have submitted letters in writing to the court. So we've been actively working on that. We're offering in a couple weeks an opportunity for anybody who's going to come to court and make an impact statement to do a walkthrough of the court system. We'll literally show them where in the courtroom they're going to stand when they make their impact statement. As I'm sure you know, this case attracts a lot of media attention. So there's going to be a lot of cameras and a more chaotic courtroom than what we see at other times. So we want victims to be aware of where the shooter is going to be seated when they come in the courtroom to give their impact statement, where the media will be, just kind of taking away the anxiety of the unknown. So we're offering that in a couple weeks to students. We're scheduling it for after school hours. They can come in a couple days during the week, as well as anybody who is a victim and making a statement as well, adults too. So we hope that that helps relieve some of the anxiety associated with this. But we view it as a really important piece in having their voice heard as victims in this case. If anybody has any questions on that grant, I'm happy to answer them. The other grant acceptance that we're here today asking for approval on is our Crime Victims Grant. This is the 32nd year that we have had this grant, and it provides $799,000. It funds 5 victim advocates and 1 support clerk. And this allows us to accompany and assist victims other than in the Oxford case. So it's a range of sexual assault victims, armed robbery victims, homicide victims, and family members of homicide victims. So I'm really proud to point out, in August of 2023, our section, Victim Services of the Prosecutor's Office, was featured in the Oakland County Telegraph newsletter that goes out to all Oakland County employees. And it was a great way to highlight the important work that's done in this division. So if you have any questions, I'd be happy to answer them, but we are asking for the board to grant acceptance of both of these. Thank you very much.
Thank you. Are there any questions regarding the two items from the crime victim grant or the anti-terrorism assistance grant? Commissioner Cavell?
Thank you. Hi, Mary.
Hi, Commissioner, how are you?
With the crime victim grant, can you tell a little bit more about how you serve folks with those advocates? Right, if I recall.
Absolutely.
You help people.
There's essentially two main components to what our division does, and one is notifying victims of what's happening in their case. So we send them a packet of information as soon as the case is charged, and they let us know if they want to receive updates, and it's usually done by mail, as to what's happening in the case. And so if they do that, they get a letter every time there's something scheduled, if it's a motion, a trial date. So they can also call Victim Services and ask for that hearing to be explained. That's one component to what we do. The other large component is actually providing one-on-one court advocacy, where a victim advocate accompanies a victim to court, to the actual hearing. They explain the proceedings. They are an invaluable help. Many victims are just overwhelmed. They're still, sometimes they're still in shock and suffering from post-traumatic stress and may not have a support system of somebody who comes with them to court. So we provide that accompaniment and explanation of what's happening. The advocate is really a link between the victim and the prosecutor too. We keep the prosecutor constantly updated on developments from the victim's perspective. So it's been great. You may have heard, we also have our famous 3 canine advocates. Those are our dogs that are in office, and those canine advocates go to court with child victims when they have to testify. Their advocates are their handlers. The dogs live with the victim advocates. They go home with them and their families at night, but they're here on site so that anytime a child is coming in, they may be coming in just for an interview with the prosecutor to get ready for trial, and we'll have the dogs available, and they make a tremendous difference in giving the kids just confidence. And many times they're in a courtroom and they are seated 50 feet away from somebody who they know and love, who has done something horrific to them, many times either sexual child abuse or physical. So these dogs sit at the feet of the victim when they're in the witness stand giving testimony, and you can readily see the difference that they make in the child staying calm enough to be able to recount what happened to them.
Thank you.
Thank you.
You're welcome.
Any other questions or comments regarding these two items? All right, the third item is information from Markeisha Washington related to our reimbursement for establishing paternity, locating absent parents, and child support workers. I already have that. Thank you. Markeisha, would you like to add anything to this?
Yes, I would. Thank you. Good morning, Commissioners. My name is Markeisha Washington, and I am the Chief of our Family Support Division here at the Oakland County Prosecutor's Office. I come before the board today to ask for acceptance of our cooperative reimbursement grant. This is a grant that it's a pass-through grant from the federal government, which is dispersed to the state and subsequently disseminated to our county. We are a staff of 24 people. Our division is established by statute, and we essentially help families to establish child support and as well as paternity orders if that has not already been established. Some of you may recall I did come before the board a little earlier. I want to say maybe it was in June, and I did ask for acceptance, and the board did grant my acceptance at that time. The reason for my reappearance is simply because there was a contract amendment amendment. It does not amend the amount of money, but there was some contract language that had to be adjusted. So I am here once again asking for acceptance of our cooperative reimbursement grant. Again, this is a pass-through grant. The county, the total amount of the grant is over $19 million, for which the county will be responsible for. That would be the state of Michigan is responsible for $13,888,721, which means the county would match that at 40. It's a match. So the state would pay 66%, and then the county would pay the difference of 44%. So the county will be responsible. We're asking the county to assist with $6,742,675.
Thank you. Are there any questions regarding this item? All right, will you prompt the vote regarding our prosecutor office recommendations?
Angel?
Yes.
You have 6 yeas, 0 nays.
All right, motion carries. Thank you for the explanations and being with us this morning.
Thank you very much. Thank you. Bye-bye.
Bye. We move on to our sheriff's office recommendations. There are 4 items. 3 are acceptance of grants. The first from the Federal Bureau of Investigation of Notice of Limits for 2024 state and local overtime reimbursements through the Joint Terrorism Task Force. The second is an acceptance from the Federal Bureau of Investigation of Notice of Limits for 2024 state and local overtime reimbursement from the Gang and Violent Crime Safe Streets Task Force. The last acceptance is from the Michigan Department of Treasury for the 2023 Law Enforcement Distribution Program, second distribution. And the last item is an amendment to the law enforcement agreement with the City of Rochester Hills. I have a motion by Commissioner Nelson, support from Commissioner Ginjo. And we have our Under Sheriff and Guy up here to talk about these items.
Good morning.
Morning.
So the first item is the annual overtime reimbursement from the FBI for a sergeant that we have in the Joint Terrorism Task Force. And as stated in their letter, the limit this year is up to $20,757. The next item is similar. It's the annual overtime reimbursement from the FBI for a detective that we have in the Safe Streets Task Force. And that is also up to $20,707. The next item is through the state of Michigan. So this is our second distribution of the MCOLS funding. We were here earlier in the year for the first distribution. This one is $113,216, and that goes towards training. And our final item is an amendment with the City of Rochester Hills. They are requesting to add 2 Deputy 2 no-fill positions effective January 1st of 2024.
Thank you. Questions or comments regarding these items? Commissioner Cabell?
Yeah. With the overtime, that's just for these specific positions?
Yes.
So then, are there other positions that have the same sort of cost reimbursement agreement?
Well, these are 2 specific ones with the FBI for those task forces. So, I mean, we do have other overtime arrangements with different agencies, but these are the 2 specific ones with the FBI.
Okay, so when we hear about like last year, there was a big thing about the need for overtime and having to fill that gap. That's speaking to, though, generally the gap in funding that is not covered by FBI or a second or a third or a fourth different sort of agreement.
Yes, that's typically jail, the other general fund aspects, and that one's the special task forces.
Okay, thank you.
Any other questions or comments? All right, prompt the vote, please.
Ginjo?
Yes.
Lubes?
Yes.
You have 5 yeas, 0 nays.
All right, motion carries. Thank you.
Thank you.
Our next two items are public service recommendations. First is a gift acceptance from Ms. Margaret Stack, and the second is an acceptance from the Michigan Department of Corrections for the fiscal year 2024 Community Corrections Department. And we have Bob Gatt here to talk about it, but I have a motion by Commissioner Gentle and support from Commissioner Nelson. Thank you.
Good afternoon, Commissioners. How are you? Before I get into what I'm here for today, I just want to give you a short report on what's happening at the shelter. Thanks to your very generous votes earlier this year, and in conjunction with Mr. Coulter's office, we hired enough staff to be open on Saturdays now. And last Saturday was our first day of being open on the weekend. And I was there, and I'm just elated to tell you that it was a constant movement. People were coming in, families were coming in. We adopted 8 animals, 5 cats and 3 dogs. That's more than double our normal average of adoptions. Staff is still being trained. It's a big job learning that computer and all the stuff that goes with it. But tonight, now Tuesday night will be the first night that we're open late. We're gonna be open till 7:00 p.m. on Tuesday and Thursday nights. So again, thank you for your generosity in the past, and I hope that by giving the public more hours and more availability to come in, they'll see some of the great animals that we have there. So with that, I'm here today seeking your permission to accept a very generous gift of $15,000 from the estate of now deceased Miss Margaret Stack. Ms. Stack was a resident of Farmington Hills, Michigan, and was an avowed animal lover. Although she never adopted an animal from our shelter, she loved animals enough to leave this generous donation so that we may put it into our legacy fund and use it to help animals in the future. We're very grateful and thankful for Ms. Stack and others like her who have the compassion and the passion for animals that is sorely needed in today's world. So again, I'm here seeking your permission to accept this very generous gift.
Thank you. That is really nice of people to do that, to think ahead. And
Commissioner, it astounds me at how many people do something like this. You know, we have to come to the board, I think if it's 10,000 or more, but we get gifts all the time. I mean, our legacy fund is very healthy, and we have some, working with Barb Hankey, the director, we're thinking about some ways to help the community by spending some of that money in the not too distant future. If you drive by our shelter right now, you see that they're erecting the outside pens that some of that legacy fund is going toward. So people never cease to amaze me at their generosity when it comes to the animals.
Thank you.
Thank you.
Any questions regarding this item? All right, a second item under public service is the community correction grant, and Eric Schmidt is here to talk about that.
Good afternoon, as we've hit the hour. So yes, I'm here today obviously to seek your approval to accept the FY24 Community Corrections MDOC grant that we applied for in the spring. And we were fortunate to be awarded more money than we ever have in the past. So we requested a little over $2.4 million. We received $2.2 million, which will continue to fund the 13 special revenue positions, as well as a couple other positions that have, it's a continuation budget essentially, with the exception of creating 2 new community corrections specialist positions, which will be assigned within our pretrial services bond and bail investigation unit, as well as our electronic monitoring unit due to excessive utilization over the last couple of years with changes in the way that bail is being done throughout the county. We're also going to fund 40% of salaries and fringes with the sheriff department position to fill a gap in services with the medical assisted treatment program that goes on for people that remain incarcerated. So that is the grant acceptance that we're seeking your permission for.
Thank you. Are there questions regarding this item? Commissioner Cavell?
Hey, Eric.
Hi.
The MAT program, isn't that being funded through opioid settlement funds?
There is a number of different funding streams for that. Because there's an issue with OCHN and their inability to serve those who do not live in Oakland County. We are funding the 40% to fill the gap of those individuals so they will receive MAT services.
Right, using
actually using the OCC grant funding for that.
Okay. So that's that's $480K or something?
No, it's $41,000.
And so we've come here before.
Right, but that's part of the overall MAP program is part of some different funding, right? Not tied to this.
Okay.
If I'm helping you, sorry.
We'll talk.
Yeah, we can
Okay.
talk.
And I probably missed the CCAB meeting where you talked about this.
That's okay.
Okay.
Any other questions? All right, prompt the vote, please.
Gingell?
Yes.
You have 5 yeas, 0 nays.
Motion carries. Thank you both for
Thank you.
being with
Thank
us. Our next item is from Emergency Management Recommendation. There is one item. It's the 2023 Emergency Management Program Grant, and we have Bob Seeley here to address this. I have a motion by Commissioner Gingell, support from Commissioner Joliet. So thank you. Thank you for being with us the entire meeting.
Oh, don't mind at all. Rob Seeley, Chief Emergency Management. I'm here with Angie Jantz, who's our finance analyst for the department. Today we're coming before you with the Emergency Management Program Grant. It's the 52nd year of this grant. This year it's $42,954, which is actually $12,258 less than last year. The $42,000 was a $12,564 addendum from the ARPA grant that the state got. So part of it is from the Homeland Security grant and the other part is from an ARPA addendum. Like I said, it's an annual grant. It pays part of my salary actually. So it's supposed to pay up to 50%. This year it's paying closer to 30%. And it was an increase in expenditures by Michigan State Police in their budget cycle, which is what caused the decrease in all 83 emergency managers in the state of Michigan.
Thank you. Any questions? All right, prompt the vote, please.
Gingell?
Yes.
Sorry. Okay, thank you. You have 5 yeas, 0 nays.
Motion carries. Thank you.
Thank you.
Thank you.
Okay, we're moving to Health and Human Service recommendations. There are 3 items. 2 are acceptances of grants. One from the Community Project Funding Congressionally Directed Spending Facilities and/or Equipment Project Program. Second acceptance is from Oakland Schools for the fiscal year 2024 Visitation Grant. The third item is an amendment to the agreement with OCHN for substance use disorder prevention services. I have a motion by Commissioner Nelson, support from Commissioner Joliet. And we have Leanne Stafford here to address all of the 3 items. Welcome.
Thank you. Good afternoon, everyone. So this first project I am very excited about, and actually Barb Henke is also on here. We're going to partner on this one together. And this is really to expand our lab capacity and actually just expand our lab. So currently, if you're not aware, our public health laboratory is over in the Crisis Center building. We've been there forever when it was Golden Oaks prior to. And so when Oakland Community Health Network moved in there, we kind of kept that space. but we've really outgrown that space. And, you know, the additional testing that we've added for beaches as well as wastewater, we really need a bigger space. And so we went and looked for a grant. And so HRSA awarded us this money, $1.2 million, to expand our grant. So we are going to work with Barb Hankey and her team, and we're going to be moving to a space over at the medical examiners. And so if you've been up there, maybe you have it, they have a great space up there, and they're going to focus all of their activities in one space. And then the public health lab will be on the other side. And so this will allow us to expand our capacity. We are actually considered one of 7 regional labs in the state, and actually also back up the state lab if their equipment is down. And so we do receive some funding for that. So very excited about this. It will take a little bit of time, and we'll be working with FM&O to implement this change.
Leanne, do you know what will happen to the space you're presently in?
Yes, so that is actually, we'll go back to OCHN. I know they had some needs in there as well. They were looking to expand some services. And so we made them aware over a year ago that we were planning on looking into funding that would allow us to move. And so I don't know what their final thoughts were for that, but it was focused around their services.
All right, thank you. All right, do you want to talk a little bit about the visitation grant?
Sure, I'll keep going. Okay, so the next grant is from Oakland, I think it's Oakland Schools, that's the, yes, okay. And so this is a continuation grant from Oakland Schools, and this really allows us to do nurse-family partnership in the southeastern part of Oakland County. So it allows us to increase our workload in Hazel Park, Madison Heights, Oak Park, and Southfield. Again, we've talked about NFP and what an amazing program this is. And so this just helps fund that. And Oakland Schools just gives us a small amount to help fund one of our staff members to do the work down there. And if you don't remember, this is really focused around first-time moms through pre-pregnancy right up to 2 years of once they've had the child.
Thank you.
All right, and the next thing is with OCHN, and it is a grant that we're receiving from them to really do educational interventions and prevention in schools, as well as in our clinic location. So this allows us to do a program called Catch My Breath, which is really focused around tobacco and vaping products in middle school youth. We also do an educational program called Michigan Model for Health. And so we have 2 full-time health educators that are paid for with this grant that go in and do this work in those areas. This is a 1-year contract with a 1-year option for continued extension or contract extension.
Thank you. Are there any questions or comments regarding the 3 health and human service items? All right, prompt the vote, please.
Kinjal?
Yes.
You have 6 yeas, 0 nays.
Motion carries. Thank you.
Thank you.
Our last agenda item is an amendment to the interlocal agreement with the City of Southfield for the 2023 Oakland County Gun Buyback Pilot Grant Program. And our own Commissioner Gershenson will talk to this. I have a motion by Commissioner Powell, support from Commissioner Cavell. Welcome, Commissioner. Oh, you're on mute.
Can't hear you. We can't hear you.
Mic on. Thank you. It was an interesting meeting. I'm sorry I couldn't be with you, but this is a really important issue that I'm hoping to gain your vote on. Last July, the board established the Safer Communities Fund, and the purpose of that fund was to allow for the withdrawal of county monies to foster a safe, supportive community for all young people, students, families, and citizens. The intended mission of the fund was to support such programs as gun buybacks, gun safety, improving access for additional school resource officers, funds for training, and programs to reduce and prevent violence. The ad hoc committee was formed, they met, and they talked about a proposal that we were given from Father Yaw from Southfield and the Southfield Police, led by Chief Barron. And they are going to be doing a gun buyback in December, and they requested some assistance. In the past, we funded several police agencies. This is just one, although it will be open to the entire county, and it will be in December, and the amount is $10,000. From $5,000 will go to the incentives for the guns, and $5,000 will be for the overtime of the Southfield Police. And Father Yaw, a little differently than the other ones, Father Yaw is out there fundraising, and so he will most likely match the $5,000 that we will be contributing for the gift cards. So we're hoping this is going to be a pretty substantial effort to get more guns off the street. So I'd like your approval today for the $10,000, and you see the interlocal agreement with Southfield Police.
Thank you. And it's a pleasure to be on the ad hoc committee. Our gun buyback program was so successful that people are asking for it again, and I think it is of great value. I would like to see this and expand it. Yeah, Commissioner Joliet.
I guess either you or Commissioner Gershenson could answer this. So you'd mentioned that this is open to other communities in December. This December, is there a form or something to?
Well, we need it before we have a tremendous amount of publicity ready and waiting to go, but we wanted to wait till after the board. We needed this committee's approval, and then we have to go to the full board. And then all the publicity will be going out. Sarah and her team have been working on great public information pieces. So you'll be seeing it at, hopefully, a meeting on November 16th.
Okay, so the for other communities to be able to apply for this, is this an amount that is within that range?
Oh, I'm sorry, I misunderstood you. If any of the commissioners have a project they want to bring forward, if you want to bring something forward to this committee on behalf of your community, that's what this committee is for. And Sheriff Childs had a great idea that he proposed to us that we're hoping to look at the next meeting. But this is an opportunity for any commissioner to request funding from this fund to reduce community violence.
Right. But is what you're asking for each individual police department to be able to
Yes,
apply to this
and it's
committee?
within this range of funding that they could apply for?
Yes.
Okay. All right, yes, thank you.
Commissioner Powell?
So just to bring clarity to that, if any police department within any of our districts has a program or something they're seeking additional funding, which it could be a program like this one, you are to submit their proposal to our staff. The staff will then get it to that committee. We'll overview it and we'll try to see if we can assist with it. So that's how that process will go. I serve on the community. I just want to bring that clarity.
Okay.
So as commissioners know how to move forward and sending us something to overview. But it's basically they're sending that proposal logistically detailing their event. Detailing all the event information we need to know, and then just the requested amount that they're requesting. And then we'll let you know what we can work or help them up to or whatever.
Okay.
Okay, got it.
Thanks.
Thanks.
Yep.
Thank you, Commissioner.
Any other questions regarding this item? Okay, so thank you. You prompted the vote.
Gingell?
Yes.
You have 6 yeas, 0 nays.
Motion carries.
Thank you, everybody.
Thank you. Bye. Our last item is public comment. Is there anyone from the public wishing to comment? Seeing none, public comment is closed, and I will adjourn this committee at 12:22. Thanks, everybody.
Thank you.
Nice job, Penny. 27 items.
Yeah.